Okay, so I wanted to just start off by talking a little bit about Healthy Hampshire and Mass in Motion. The Mass in Motion program is a statewide program, and there are many communities. There have been many communities in Massachusetts that have been participating in Mass in Motion. So essentially, we are like the local version of the Mass in Motion program. I wanted to say that Healthy Hampshire has been coordinating a Mass in Motion initiative for almost 10 years now. And historically, we have worked with Amherst, Belchertown, Northampton, and Williamsburg under the Mass in Motion grant. And what happened last year was that the Department of Public Health that runs the Mass in Motion program opened it back up for existing partners to reapply and for new partners to apply. And we took the opportunity to try to get more of our partner communities in Hampshire County kind of under this umbrella of the Mass in Motion program. And so I'm going to try to find my little note that lists all the Mass in Motion communities for me, because there are quite a few. So we went from just working with 4 communities to now we have 18 communities that we can work with under our Mass in Motion grant. And those include Amherst, Belchertown, Blandford, Chester, Chesterfield, Cummington, East Hampton, Goshen, Huntington, Middlefield, Northampton, Pelham, South Hadley, Southampton, Ware, West Hampton, Williamsburg, and Worthington. So if you have any connection to any of those communities, you're in the right place. We're really happy that you're here. And you'll hear more a little bit about what Mass in Motion is tonight and how it works, in our local communities. But I just wanted to say, we've been at this for a while. We're sort of just excited to, re-up our commitment to Mass in Motion in Hampshire County. We have essentially a 1-year grant that's renewable for 10 years. So this can be a very long-term relationship that we're building with each of your communities. And we're really excited about that. We're starting somewhere. We're starting here with this introductory session, but we know and we hope that there will be a lot more relationship building in the months and years to come. So we're really grateful that you showed up to learn a little bit more. And I think that's all I'll say for now. So who am I kicking it over to? Cynthia.
Take it on. Thank you, Caitlin. Hello, everybody. Good evening. Thank you for allowing us in your living room space at home through Zoom. Very grateful to be here this evening with you all. Cynthia Espinosa Marrero, I use a she, her pronoun series, and we'll go more into details. And I am with Health Resources in Action. We are a nonprofit organization that's here to provide technical assistance and support to Kaylin and Kristen, Healthy Hampshire. And we want to sort of lead a conversation with you all about what Mass in Motion is and kind of get us all started. I'll just pass it on to Allison to share our presentation, and then we'll get the ball rolling. If we can go to the intros and group building. So have many people heard of icebreakers? I imagine yes. We're going to shift it up now and sort of build roots together to want to get to know each other, but also we like to build roots, grow things, maybe grow food. I know I'm one, many of you are. So we're excited. So what I would like us to do is, I know that we might have been sitting in a chair for a while, or we've been pretty busy, and want us to lead us in a fun activity. Actually, if you could stop sharing the presentation just to see everybody, we'll go back and forth, y'all. It's actually, if this is Creator, I know we have a big group. We have about 20 folks here. What I want us to do is to stretch our bodies, but we're actually going to stretch in the shape of our name. So you're going to spell out your name with your arms or your whole body, however you want. It's going to be funky and weird, but we're going to give it a try. So whenever you're ready, we'll try to, stretch our names, or stretch our body spelling out our names. So, C is for Cynthia, you can say it out loud. Trying to figure out the N. The T, the A's, you know, and it can be a silly movement. The I, and the A. And we kind of shake it off a little bit. Mhm. Thank you for enjoying me and entertaining me in this fun, funky activity, but I think it really helps us get us going. And if folks feel comfortable putting in the chat feature, we kind of see your name, but if you want to put another nickname or your name, your pronouns, so this is how do you identify as, and the other one is, sorry, I want to make sure I don't say it, your favorite local food. This could be something that either you got from a restaurant, you grew, or you got it locally, or however it got to you. What is your favorite local food? So feel free to put that in the chat. Now, and we'll sort of read it out loud. Well, if you feel comfortable and brave enough to speak it into the space, feel free to unmute yourself and do that. Corn on the cob, tomatoes, blueberries, yes. Apples, yes. Strawberries, awesome. Corn on the cob, oh, so you get two corns on the cob, yes, those are delicious. Plums, thank you. Cider donuts, my favorite now in the season, yes. Yes. Also, thank you for helping me create a shopping list. I'm just kidding. Japanese knotweed, yes. Oh, I would love to learn if you have recipes on that. That's a new one, so that's awesome. Too many to choose. I hear you, Alexandra. I hear you on that one. So thank you all for entertaining us in that portion. We can go back to the slide to sort of get us started. Ooh, Garcia's restaurant. Yes. All of that. Thank you for sharing all that. And this is also a way to continue to get to know each other and help. And we always sort of come around food, right? So this is great. Thank you, Mo, for tuna. Yes. We can go to the next slide. So I wanted to share with you sort of the agenda of today. I wanted to give you an introduction to Mass in Motion, as Caitlin mentioned, and you probably will continue to hear it. We wanted to give you a sense of what it is and what it looks like. We're going to do an activity to learn more about your towns, in which we'll go into small breakout rooms. We'll take a little mini break and then come back to talk about root cause analysis and needs assessment. And really, we want to also make time for networking to share the role that you all play, all of us in this work, and then the next steps. Any questions so far? No? And feel free to write your questions in the chat, or if you haven't throughout the presentation, raise your hand feature, unmute yourself. We're here to really have a conversation and get to know each other. So we can go to the next slide. So Mass in Motion, this is sort of the mission statement, and just wanted to sort of really give you the bigger picture of the vision of what Mass in Motion is about. So it's a municipal wellness and leadership initiative, really coming from the Department of Public Health. And it's really also a movement to lower the risk of chronic disease by addressing root causes. And we highlighted that piece because we'll talk more about it, that impact opportunities for active living and access to healthy and affordable foods in cities and towns throughout Massachusetts. So DPH and all of us, we are going to work with diverse network of partners, Mass in Motion's communities like Healthy Hampshire is, really then implement proven policies and practices to create environments that support healthy living. That was a lot of wording, right? But we're going to break it down a little more. If we can go to the next slide. And I will actually also invite my colleague Mo to help us with this part of the presentation.
Hello all, I'm Mo Barboza. I serve as Senior Director of Community Engagement at Health Resources in Action. Some of you I know and have interacted with before, some of you I don't, so happy to make your acquaintance, and so excited about this new rendition of Healthy Hampshire and all the towns that are a part of it. 18 towns is awesome. I hope that you all will feel that way also. Just quickly on social determinants of health. These are the outside forces that are acting on the people in our communities. So not their individual choices or their health backgrounds, but the things that are acting on them. And what you see in front of you is a chart of how we've thought about the work that we do. So for a long time, we measured and really thought about the mortality. So when people were affected acutely by something or when they passed away from it. And that was what we were trying to, in essence, prevent. With that came, and as obviously we're still in a pandemic, a focus on disease and injury prevention. So if you see those are kind of to the far right of the chart, we think about those as really downstream things that we're doing. Those are after the things already in place, after the cause has already caused the harm. It's almost like we're dealing with the results of the harm being caused, and often even just looking at symptoms and not even at what's actually happening there. Over the years, we've moved a little bit to the center, looking at the behaviors that might put someone at risk, and then also what are the living conditions, what's happening in the areas where people are, what's available and not available there. So think about this as something like a farmer's market. It's about putting food where people are able to get to it. What we're really trying to do with Mass in Motion is move further to the left, as it would be here on this chart, and really address the institutional power and the social inequities that create and cause the problems that we're seeing on the other four bars on the chart. So how do we stop people from being food insecure? So giving them food after they're insecure is kind of dealing with the problem after it's happened. We really want to go upstream and remove the obstacles, remove the barriers, remove the causes of what are keeping people being insecure about food or not exercising or all the other things that make us unhealthy. That's a just quick overview of social determinants of health. Probably the most important thing to think about is like, it's not people's choices. It's really what do they have to choose from and what causes those things to be in place. I'll pass it back to Cynthia.
Yeah, you can go on the next slide. And this sort of gives you a little bit more of examples and definition that Mo explained on that end. So again, really Mass in Motion is focused on the left side, the social inequities, really looking at class, race and ethnicity, migration status, gender, sexual orientation, and also the institutional power, corporations and businesses, government agencies, schools, laws and regulations, and nonprofit, and how all of these play together to lessen the harm that goes to the right of the chart there. We can go to the next one. One thing with Mass in Motion as well, there's a framework of leading with race and addressing structural racism. So the first principle, it's really to address structural racism in addition to other forms of oppression. You can go. Center people with lived experiences of inequities and share decision-making power. Identify and address root causes of health to create equitable solutions. And be aware and address that our work may have unintended consequences that may cause inequities or make it worse. You know, this is just, again, a way of principle, like values that we can all hold together, that Mass in Motion really holds with all the communities selected. And it is, you know, mentioned to all communities to really hold these principles also in hand when making their work happen. We can go to the next one. So Mass in Motion. So we talked a lot about root causes and all these big words, and we wanted to kind of break it down more, like what it feels more realistic, right? Because we are not, with Mass in Motion, it's like one way to address root causes, right? There's many other ways, and you are all here together to work on this together and address it and really build partnerships and genuine relationships with people with other experiences, but also with each other, because you will always be working together towards really the principles and the goals mentioned. Really also identify structural racism and other forms of oppression with curiosity, right? We always want to have curiosity. We want to have the willingness, both from ourselves, but also with groups or organizations or relationships that we represent coming here, and openness of in sort of like the humbleness of like we are all learning and coming together. We want to work in a manner that is timely, but is also not rushing the work, right? Because it took time for everything to, all the systems to be put in place. It's also going to take time to redesign them and do it in an equitable way. So we also want to have transparency on that, and then realize that our work today, we are probably not going to see sort of the fruits of our labor, how many say it. This is really thinking of the future, all the policies, all the practices, all the really incredible work, both inward and outward to our communities, really what's gonna come in the future. Teamwork, that's sort of the big one. All here, we are all a team. Both from us as technical assistance provider to Healthy Hampshire, to all of you all in your towns and communities, we all are gonna work together towards this and continue that, and also celebrate. We really need to celebrate the accomplishments that we are going to do, they have been doing. We're here together. That's a big accomplishment already. And really continue to look towards the future of what is to come. So this sort of gives you a little bit more what Mass in Motion is about. We try our best to kind of break it down in a way that feels fun, realistic, exciting, and knowing that you're not alone to do this work. So I'm going to pass it over to my colleague, Allison, for the next part of our activity today.
Hi, everyone. My name is Allison Shifley. I use she, her pronouns. I'm an associate director at Health Resources in Action. I work alongside Cynthia and Mo, and we're going to do some breakout rooms. So I think Caitlin or Kristen, you guys are going to pop open some breakout rooms in a moment. But one of the things I want to do while we're in there is to have you all introduce yourselves to each other, right? The point is that we're coming together as a group. Hopefully y'all will be working together. And we're going to really ask the question, what does your town do to support healthy eating and active living, right? What are y'all doing already? And maybe you also have some thoughts on what you might want to see happening in your town and in your communities. Any questions before we open those breakout rooms?
My question is, do you HRA or MAPC folks want to be assigned to breakout rooms, or do you want to stay here in the main room?
I think we can, no, we can stay here. We'll stay here. We'll let you all go into your groups and get to connect as people representing Healthy Hampshire.
All right, I'm putting Jessica in a breakout room because she said yes. All right.
Great.
I will go ahead and open the room. So you should get something popping up inviting you to join a breakout room.
Should get a pop-up, or you might have to go to the bottom of your screen.
Looks like people are making their way there. All right. We have a couple of folks still here in the main room. If you're here in the main room and you are having trouble joining a breakout room, let us know.
We can also have a breakout room in this main room if that.
Yeah. I just think sometimes people have stepped away, which is why they're joining a breakout room, so I just don't always know.
Stepped away and or frozen in the act of going to the breakout room.
Okay. How long do you want to have these go for?
How big are the groups? I can't see them.
They're like 3 to 4.
Okay, so we just need enough time for them to introduce themselves and have these conversations. I think we budgeted, didn't we budget like 10 minutes for
10
this?
minutes, you know,
Yeah.
we can do less if needed, or
So let's go for like 7 minutes and see what happens.
some folks are moving. Hold on. Mhm.
And Caitlin, did anyone end up using the Spanish line?
No. Oh, wait.
Okay.
Ooh, hold on. Yeah, maybe we should let Alexis go. We
I'll
just
give it a little bit longer.
give it a little bit longer.
Yeah,
Yeah,
it's only been 25 minutes, you know.
yeah. Okay, Alexis, we're keeping you here.
All right, I've been talking this whole time, just in case.
We
Nice.
appreciate you. There is a phone number. I think they joined in recently.
Yeah.
Mhm.
Hello, who's on the phone? Don't know. Mystery person.
646. Is that 884-1707?
Yeah.
Sayumo?
Nope.
Is there a way you could assign folks to the room? I know you did. They have to accept to be moved, right? I'm still learning like this in pieces.
They do.
Yeah, I actually don't know. How do breakout groups work with people who call in?
Same
So-
idea. Go ahead, Allison.
So there's two things. If they call in, you can pop them right in. If they call in on their phone for audio, and then they might also have a video.
Mhm.
Some people use the link either on their phone, on their computer. They can do that and like join those. So when they look at their screen, if you press the little caret next to the mute button, it'll say join by phone, and it'll give you a call-in number. And so
Mhm.
they can do that, and that those two screens merge into one, which is very helpful when you do breakout rooms, so they're not in two different places.
Mm. So, but do they get like, how does, if I move somebody with a phone number into a breakout room, do they get
Yep.
the option somehow to join or not join?
I think it just automatically moves them.
Mhm. Well, we lost our phone number. Our
We
mystery
haven't heard from
phone
Laura
number.
or Roxanne.
Yeah.
Hmm.
Laura, Roxanne, do you want to be in a breakout room?
Caitlin, how's the attendance here tonight?
A little low. We had like 20-ish people register, and I think in typical fashion, like some people didn't show up. But yeah, I mean, it's interesting to see. It sort of feels like we have more community folks here actually than municipal folks, which is interesting to see.
That's cool.
Yeah, it is cool. And it's raises some questions about how we continue to try to reach out to and engage our municipal folks. We've kind of been reaching out and engaging the municipal folks in like communities with significant environmental justice populations one-on-one. So we've been having some really good conversations with municipal leaders in those communities about engagement opportunities. But yeah, I mean, I think it can flow in both directions, right? Because community members can also be advocates to their municipal leaders. So all are welcome for sure.
Awesome. Cynthia, do we still want to have a break after this, or do we want to just keep rolling? I would just think keep rolling. We're a little ahead of time.
Yeah, we can keep rolling
Awesome.
for sure. Definitely, if we want to give some time for folks to like share out if they feel comfortable as well.
I actually don't know how long we've been in breakout rooms. Maybe you should just let me know
I think
when.
we have another minute or two of them in there.
Thanks. I've been
in doing a lot of breakout rooms this week, and so I've been paying attention to the time for like the first time in the last 2 years, really.
Y'all are good. I can't trust myself to be watching the clock, so I always set it.
Well,
a certain
yeah,
number.
usually I set a timer.
I know. I meant to ask if you wanted me to do that, and then I forgot.
It's all right.
If you're good, it's actually a good practice to leave it, because sometimes you can see how the conversation is going. And
Yeah, I set a timer on my phone for me. Yeah.
I'm habitually like cutting people's conversations short, like.
Oh no, it's like in the middle sentence and it kicks you out.
There's no real way to know.
Yeah.
Are there 3 breakout rooms?
Yes.
Okay.
I'm guessing they probably are pretty,
Yeah, it's been 6 minutes, so you can do the room close, and it gives them another minute to
Yeah.
pop back.
go. Should be coming back in soon. Ooh, I'm hungry, I just realized,
'Tis that time.
right? Oh man, Cynthia, you'll appreciate knowing that I'm still on my neighborhood listserv in Northampton, and there's a lot of emails flying around about a rooster.
Oh my goodness.
It's a very controversial rooster in that neighborhood right now.
In Cambridge, when we passed the ordinance, we had hens only.
Yeah.
Yeah, I think I haven't actually seen, I haven't been following it today, but I haven't actually seen anybody like cite any policy yet. So we'll see.
As the city kid, I was baffled by how do you get eggs without roosters? And of course, people had to disabuse me of that one. So it's like, oh, we are useless.
Welcome back, everyone. Are the rooms all set?
Mo's been showing his hand to you, rural folks who know all about backyard chickens.
I would love to hear what some of y'all talked about in your breakout rooms and what some of your towns and communities are doing right now to support healthy eating and active living. Marta, please.
Good afternoon, everyone. Yeah, we had a group. It was Sergio, Jeannie Gonzalez, and myself, and we were talking about how can our town help more our community, and we talk about that we wish the town would do more. I know they do it a lot to help the homeless people, because it's very sad that at this time to see somebody homeless. We don't know the situation that happened in the past. And also we don't even know if it's they choose to be that. So which to me it falls into mental issues, and that's why that's what we believe on that. And we also talk about the mobile market, which for what I understand, Jeannie said that it's the last week this week. And it's fantastic because, you know, a lot of people get easy access to the fruit and the vegetable, and a very great price. So that's what we talk about.
Awesome. So right now, mobile market and things that you want to see is more support for the homeless population.
Although they, you know, it's a good thing, it's a blessing that they have places that they can eat and stay overnight. Like the Survival Center and No Bread Alone, which I understand that No Bread Alone also give supply food on the weekends too. That's something that the Survival Center don't do on Sundays.
Yeah, so there's places right now who are helping to provide food.
Yes.
Okay.
Yes.
Awesome. Thank you so much for sharing.
You're welcome.
Thank
We
you.
also talked a little bit about lack of sort of maybe more support exists so far around the healthy eating and food access and less around active
Okay.
living. And we were talked a little bit about lack of sidewalks and also sort of a lack of things to support active living that aren't like gyms, which are expensive.
Great. Yeah. So thank you for bringing up and noticing that there's right now a difference, right, in terms of both of these things and what is getting some more support currently and what maybe needs to get some more support with some of the work that y'all doing. Fantastic. Thank you. Anyone else want to share what y'all talked about?
I learned that in Northampton, there's a really great food policy council that has evolved over the years.
Awesome. That's fantastic. Yeah. Get another share. You can also put it in the chat if you'd like to.
Anything from the hill towns?
This is embarrassing, but how do I see you guys again? Can you put us back on, how do I see you to know that I can share? Or
So I think your camera, are you on your phone?
I'm on my iPad.
On your iPad? So you have the camera facing away from you and not towards you. There you go. Can you see us now?
No,
Oh,
I see
can't see
breakout
us?
rooms. I see the slide.
Oh, you just see the slide. Here, let me do this. How about now?
I see you. And now
Okay.
I'm gonna switch. There we go. There we are. There we are. There
Perfect.
you are.
Perfect.
So I met out with people from Williamsburg, 2 people from Williamsburg, and I live in Goshen. And so we were talking about sidewalks as well. And I just recently heard from some people who live in the community elderly housing across the street from our Goshen Town Hall that it's actually hard to cross Route 9. Just they're exactly right across the street from the town hall, but many people won't come to a council on aging activity because it's hard to cross Route 9. So anyways, that was interesting.
Yeah.
And we're trying to figure out ways to kind of solve that problem.
Yeah, that's a very powerful insight and something to work on. Absolutely. Thank you for sharing. Also, we have something in the chat. The YMCA Hampshire County Northampton has great financial assistance and supportive programs, including Prescribe the Y. Awesome. Those are helpful when they can be kind of included and therefore lower cost for the financial side, because gyms are expensive, just exactly what we were talking about. Anyone else want to share? Okay. Thank you all so much. I hope you got to meet some new folks and have some great conversations. I know it was only a few minutes, but again, this is just kind of an introductory conversation right now. And I'll hand it back over to Cynthia.
Thank you. Thank you all. I'm actually going to pass it on to our amazing colleagues and other technical assistance provider, MAPC. So Sharon and Jessica, take it away.
Thank you, Cynthia. My name is Sharon Ron, she, her pronouns, and I work at the Metropolitan Area Planning Council. And like Cynthia, Allison, and Mo, we are technical assistance providers for the Mass in Motion coordinators, coalitions. So we're here to support you all as you figure out what the work you're going to do, and then support you as you do your work, just sort of as partners on this journey of Mass in Motion. And can support in thinking through what it is the work you want to do, what information you need to track down, sort of everywhere from the beginning of an idea to the execution of that idea. Today, we're going to talk about root cause analysis and needs assessment. You have heard us talk a lot about root causes today, and this is the process that the Department of Public Health is asking Mass in Motion coalitions to go through to identify what are those root causes in their community that they want to work on, and what needs is it addressing. I'm going to talk a little bit about the concept of root cause analysis and the different steps. Note that these are being asked for you all to do with Caitlin and Kristen in the next few months, but that the activities I introduced today can be used anytime in the next 10 years, whenever you have a lot of information that you're trying to think through or trying to think, okay, we know that this is an issue, but how do we move from collecting information about problems into a solution space? These activities can be pulled up and can be used. And if you ever need help doing them, Caitlin, Kristen, my colleagues at HRIA, us at MAPC are happy to be partners on that. So with that as preamble, what is a root cause analysis? A root cause analysis is a process to identify the root causes of a problem in order to identify appropriate actions. The goal is to prevent and solve for underlying issues rather than just treating those symptoms as they pop up. So the easiest way to understand that might be looking at a common problem. I'm going to use one that sort of connects to some of the things that you all brought up just now. So say you don't have a way to get to work because your car broke down. So that day you might call out of work or you might call a friend and ask for a ride, but that would be treating the symptoms of not being able to get to work. If you started to think about the root causes, you might want to bring your car to the mechanic to figure out like, what is going on? How do I fix it? But if you've gone to this training and now you're thinking about mass emotion and root cause analysis, you might think like, why don't we have sidewalks? Why is that intersection getting to my work job so busy that I feel like I need to get in that car and drive to work? I don't have any other ways of getting around. And so root cause analysis is just a series of activities and questions that sort of talk you through thinking about the problem and getting to some of those root causes that you can start taking action on. Next slide. And thank you, Allison, for helping me with the slide deck. Shout out. So as I mentioned, root cause analysis is a series of activities, and what you're doing in those activities is you're collecting information on the social determinants of health, the things that we talked about front, and health behaviors and outcomes in your community. And you're using that information, you're just collecting a lot of it and trying to funnel down into a strategy that you want to work on as a Mass Emotion Coalition. You're going to collect information on health outcomes and behaviors, things like diabetes and asthma, but you're also going to collect information on the policies and environments where people are born, live, work, play, etc. Those sort of root causes. So that might be whether, see there's chatter about chickens. So that might be like, is there an urban ag policy in all of these communities? It might be like, what is the sidewalk network around the senior center? Collecting information like that that's a little bit less concrete of like health outcomes that you get from a hospital database. Yeah. So there's about 4 activities that make up the Mass Emotion root cause analysis needs assessments, and each one of these activities can be done once, multiple times, as many times as you need to be helpful. I'm going to describe each in detail in the next few slides, but I'm just going to note that here, interviews and group conversations, community engagement is noted as an activity. However, it is an activity, it can and should be part of all of these activities. You can do these activities alone, but also think about who else you might want to involve in asking these questions and exploring these issues and collecting information. In that, you can here already, you can do these activities once, or you can do them many times. And each time you do an activity, you should be learning from what you're doing and using that information to inform the activity that you do next, with this idea that like you're narrowing in on the information you're collecting, the questions you have, and trying to reach actionable causes that can inform a strategy of work. So the first way that you can do these activities is interviews and group conversations. So that might be bringing together different groups of residents, community organizations, and city and town leaders, such as you all on the call, and having a conversation similar to the one that we started to have, just sort of as a teaser of like, what does your city and town do to support healthy eating and active living? You could also in that conversation have more prepared conversation questions around like, do you know who's in charge of updating the sidewalk outside of the senior center? Or you could use that time together as a group to do an exercise like the ones we're going to describe, or look at some of the data that you've collected from a hospital and sort of ground truth it in lived experience. A great activity to do with a bigger group of folks when you're trying to get from like, okay, we're seeing this health outcome, we're seeing really high asthma rates in youth, like, but what does that mean for the work that we need to do, is to start looking at a tree exercise. So with the tree exercise, you're literally looking at the root causes of the health outcomes. So our health outcomes are the leaves of the tree, the behaviors are the trunk, and then our root causes are, you guessed it, the roots of the tree. And so how you might do this exercise with folks is asking people to list their diseases and health outcomes that they've either experienced or observed in their community, and that would be your lead. And then you ask what behaviors might contribute to those health outcomes and behaviors. Those health outcomes, and that is your trunk. And then you ask folks about those social determinants of health, those social, economic, political determinants that are influencing the behaviors that they just described. And that becomes your root causes.
Sharon, I'm
yeah.
sorry, I just want to interrupt really quick. Alexis, it looks like you can go. We also sent Mariana home. So thanks so much for coming.
Not a problem. Thank you so much. Have a good evening.
You too. Bye.
Thank you for that. Often when you do this exercise, you're going to find, like we sort of did today, that people are describing both outcomes and are describing causes and are describing behaviors. And so often we do this on Post-it notes, and so it's easy to move things around, just like a hot tip. Next slide. This is an example of what a completed tree exercise looks like. And it shows you that it gets you, like, it visualizes the root causes in a way that allows you to see what you're working towards, those better health outcomes, and what you need to focus on. So things like noise, jobs, violence. And it also, once you have something like this, you can just start talking about how they're all connected. Things might not always have to go through the trunk to get to the leaves, unlike a real tree. For example, violence and crime can lead directly to injury, but it also could cause folks to be feeling less safe to go out in their communities. So it might lead to a lack of exercise, which in turn could lead to diabetes. So, like it starts provoking, this is sort of a beginning of a conversation about how your community can start influencing the health of its residents. Next slide. Data analysis is another and powerful tool in root cause analysis. We always recommend starting with data that has already been collected. This can come from hospitals, it can come from nonprofits, it can come from your city and town planning office. We are always happy to sit down and think you through what data might be available to you already. Once you have data, exploring the numbers with an eye for patterns or things that jump out to you for meaningful. I have a couple of questions that I'm usually asking when I'm looking at these big charts of data. The next slide, which is sort of, what is this information telling me about my community? What seems meaningful here? What, after looking at these data points, do I want to learn more about, and any early conclusions? And I think that's something to stress here is, like, when looking at numbers, I think our eyes are normally drawn to things that look bad, like evidence of health outcomes that are worse than the state as a whole. But that you can also be looking for places where your community is doing really well. That might be a strength that you want to build on. You can also look at places where there isn't data, where you think there should be data. That might be indication that your community is not doing enough work in this topic because no one's collecting data on what's happening here. So all of that is to say that data collection doesn't need to be just you creating a laundry list of issues in your community, that it can be used more as a ground to talk about strengths and where there might be gaps too in work. And then the final exercise in the DPH Mass in Motion root cause analysis toolkit that I want to talk to you all about tonight is the fishbone exercise, where the tree could have many, many leaves. The fish only has one head. And so the purpose of this exercise is to focus on one single health symptom, a problem, an effect of all those root causes, and put it on the head. And then, like the tree, start thinking about what are the ribs that build up to that head? What are those root causes? And try to map out all the root causes for one effect. If you want to get fancy, your ribs can start doing things that fish ribs shouldn't and starting to break off into contributing factors. But the nice thing about this activity is it allows you to focus in on one topic. And like I said, this whole root cause analysis is supposed to be helping you funnel in focus, focusing on one topic and really start breaking down all the different things that are causing that topic and help you decide, like, you know what, cause 3, I can't do anything about that. That's statewide policy, but on a local level, we can start working on cause 1, which is something that community groups can organize and do locally here now. And we'll keep an eye on cause 3 down the line for when the political environment is more open for this conversation. The other benefit of this is it really a nice visualization of like from cause to effect. So I'm going to stop there and see. So I think overall, the main takeaway from today, that was a lot of information, is that root cause analysis is a process that's helping you get from a root causes of conditions and narrow in on appropriate action. So with that, I will pause and see what questions do you all have about root cause analysis and needs assessments. And I might also open up the space for Caitlin, HRIA, you are just as experienced in these activities as I am. Are there other things that you might add to that sort of whirlwind explanation of root cause analysis?
I guess I would say like that these specific activities are one way to do it, and there are lots of ways to do it. And you know, I always think it's really important to acknowledge how much work has already been done in all of our communities to collect a lot of this data, to identify needs. Some folks might be familiar with something called a community health needs assessment that the hospitals do every 3 years. And so just to note, you know, there could be activities you're doing with groups that you're working with already that are essentially, you know, in line with being a needs assessment or root cause analysis. And we, you know, from Healthy Hampshire's perspective, really just want to try to strengthen the activities that our communities are already doing, and, you know, acknowledge that a lot of communities are thinking about these issues, and we just really want to support that.
Thank you for that perspective, Caitlin. Allison, if we can maybe stop sharing the screen for a couple of minutes to see if we can see everybody, and if questions came up, feel free to speak or write it in the chat. We would love to hear your voice. Oh, there you go, Carrie. Go for it.
How do you go about getting that data? Like, so I'm new to my position for sure. So I apologize if I'm, you know, if you guys already all know this, but so like you just said, community health needs assessment is done by local hospitals. Like, so that data is out there for Goshen. Yeah. And how do I get it?
Yeah. So I think Goshen, I think Goshen is in Cooley Dickinson service area. So you would go, you could just Google Cooley Dickinson Community Health Needs Assessment, and it'll probably take you to Cooley Dickinson's community benefits page. I can try, while we're here, I'll look up the most recent community health needs assessment, and I'll put a link to it in the chat, but it should be available on the website. So I'll grab that for you.
I would just second that hospital needs assessments are a great place to start. They do one of these every 3 years, and they ask very similar questions about root causes that Mass Emotion does. So starting where others have already laid the foundation is wonderful. Also, area agencies on aging tend to do needs assessments frequently about their population. That might be another valuable source of data on older adults in your community.
Sorry, would that be like the Council on Aging? Like that's what I'm supposed to do?
Yeah.
Go ahead. I think the AARP, I do feel there was a needs assessment done recently. But it's interesting to know that the hospitals also do one every 3 years. Like that's amazing data I got. Oh shoot. Okay. There I am. Okay. Thank you.
Any other questions or comments?
Well, I guess one question I have for folks who are in the room is, I know we have a lot of folks here. I know we have a couple folks involved with councils on aging, and then we have a number of folks who are involved in sort of more community-based roles. And so I'm curious for the folks who are in kind of community-based roles, like how you imagine applying this in your community. Like, would it be through advocating to your local municipal leaders, or would you be interested in like having conversations in groups that you are part of or working with, to talk about root cause analyses? Like for the folks who are sort of just in community, like how would this look for you? Don't all answer at once.
Well, I'm going to say something that I'm not sure you're going to be happy to hear, but I'm clueless at this point. I think that process of root cause analysis is very weighty and needs to be explained. I could not possibly do it at this point. I think more training would be necessary.
Yeah, and that's definitely something we can help with. And for example, with you, Tamara, I know you work a lot with seniors in Williamsburg. And so we could think of, folks who visit the Williamsburg Senior Center as a group that we might want to do this tree exercise with, for example, so we as Healthy Hampshire staff could come in and, work with a group of folks that you bring together and have this conversation about, okay, when you think about your local community, what are some of the health outcomes you're seeing? What are some of the health behaviors? What might be some of those root causes? So we're definitely happy to help with that. I saw Alexandra and George both unmute themselves. So yeah, go ahead, Alexandra.
That was really helpful to hear what you just said. And I think that facilitated conversations for community members and groups would be a lot easier, because if you're not given that vocabulary and what we're kind of looking for, and some people might not even know how to express that. They might know what's happening with themselves, their friends, their neighbors, but they may not be able to say that's an outcome of racism or being low income or, systemic stigma or whatever the root causes word pool you would be looking for. The question I would have too, and I think you would address this in a facilitated conversation, is, people don't necessarily want to talk about these things, not knowing what you're doing with their information and why you want it. So as an outsider coming in to speak with community, or even as myself, a community member, I would like to hear more about how you would address that.
Mhm. Yeah, I think that's a great question. I'm curious if HRA or MAPC folks have thoughts about how to communicate around that.
I think it's a real concern. I think when we do things like conversations, we set the expectation and we are clear about what information we're recording and what information we're not recording. And we try to always not record personal information. So even if we're collecting things that you say, we're not connecting it to who said it. And we won't even collect who comes to the meeting really. Maybe we'll collect general things about age, but nothing about actual name or identifying details. So that's one way that we try to respect confidentiality in how we collect information and being very clear about what we're doing with that information. I would say for in this space, and I would open this again up to the Healthy Hampshire folks and Cynthia and Allison to reflect more on, is it's also a lot about like ground setting in the meeting, about setting a tone of what happens in this space is shared in this space doesn't leave the space. You can share, what is it? It's like share stories, not the
Take the lesson, but you keep the details in the room, right? So
thank you, Allison.
I think when we start trainings, we spend a lot of time like setting kind of group expectations or norms, group agreements they're called, to really set the space up, right? And so that people are very clear in terms of like, again, what is happening, what is being collected, and we do want to like, we want to take that lesson, but we want to keep the details in that room, in that space that we've collected, and also having kind of multiple ways for people to share when we're having, like if we're doing the tree activity, you might be handing out post-it notes that people can write on, and that's more anonymous if you like collect the post-it notes versus having people say it out loud all the time. So having usually multiple ways of people sharing information can also be helpful in this area.
I also think the context of the particular group that we're having this conversation with and how those people have been engaged over time is really important. So, we might be having this conversation in the context of a group where we've already built a lot of trust, or whoever is leading the conversation has already built a lot of trust, or we can partner with a leader, who kind of understands why this work is important and wants to, kind of communicate it and champion it in their community. I don't think we need to, I think the best way to do this is to build on trusted community networks, and really, think about the conversations that have been having that folks have been having, and how to build off of that and sort of strengthen and deepen it. So yeah, it's a great question though, Alexandra.
Yeah, and I'll just jump in and say congratulations. So I think this is really what Massive Motion is about, to really make space and time to really acknowledge, okay, what are some challenges from the past when it came to engagement? Research fatigue, how they call it, or communities that are, disenfranchised are always asked, what do you need, and nothing happens. And that is real. And I think being able to acknowledge that from the beginning is a really important point in how you approach it later. So I want to congratulate you all to really start having those conversations. And I think the beautiful piece that's happening here, you got different answers or different approaches. And I think part of it is that in order to engage community, it's complex. It's going to take different approaches, different times, different relationships. And that's all part of the process. So like it was mentioned before, working in a timely manner, but not rushing, and really thinking of how to address those potential forms of oppression or re-traumatizing people to really get information, but also acknowledging the barriers that they are for engagement, and what can we provide to make it a safer space, right? Do you have families that have little children and they don't have childcare? Can we provide that? so that they feel a little more less stressed and can actually focus on that happen. Depending on the time that it is, can we provide sort of your needs, your physical needs? Do you need, place to eat, or do you have food provided? Do you have interpretation available for the languages or, that are available? So I think all of that comes into the planning of how to engage the community. And one approach is definitely having those community meetings and facilitated conversations, but it's not the only approach. And it's definitely something that we recommend anytime and everywhere that we go is transparency of like, this is the bigger process and this is how we're going to sort of get there. And we know that this is just one piece of the bigger puzzle there. And I wanted to pass it on to another colleague of ours, Matt Barron, who's another technical assistant. So go for it.
Hi, and yeah, I was just raised. Can you hear me? It's the first time I've spoken, so I just want to make sure. So my name is Matt Barron. I am a technical, I provide technical assistance as well for Mass in Motion. My focus is in municipal engagement. I work for the Massachusetts Association of Health Boards. Just what does that mean for Mass in Motion for Healthy Hampshire? Each year, Healthy Hampshire is going to attempt to tackle specific strategies to better their community. And realistically, each strategy that is pursued is going to involve or require some sort of cooperation with the local government in order to best achieve it. And what I'm here to do is to help support that cooperation. But I did raise my hand, Alexander, specifically to talk about your question that you had about maybe some sort of maybe being uncomfortable having some of these conversations or being there. And I think part of something to just be cognizant of is that some of these root causes that may be found within community have been created or maybe even accentuated because there's perhaps a stigma in talking about it. And so also to keep in mind that the goal of Mass in Motion might be also to really shine light in some of these conversations that there's been a stigma not to have it to this point. And so that may cause some difficulty in people sharing or some, but at the same time, there is part of the goal is to be able to bring this out to light and to get rid of that stigma. And that's so to alleviate some of that discomfort.
George, did you have something that you wanted to add? I saw you unmute yourself a while back.
No, not in the moment, not in the moment. A lot has been addressed. I'm still learning, trying to discern, the active function of the organization.
Yeah, absolutely. It's I think that unto itself is a really great question. And I think we did some kind of like information sessions back when we were applying for the Mass in Motion grant. And so we didn't want to hit people with like the same information over and over again. But definitely, it's a little complex and like hard to understand. And essentially, just to start to try to answer that question, Mass in Motion is really essentially it's a pool of funding that the State Department of Public Health distributes out to a bunch of different communities in Massachusetts. Communities had to apply to become Mass in Motion communities. In a lot of other places, a Mass in Motion community might be like a city, and we might be looking at a mayor working with multiple departments and kind of having the locus of all of this really be, in a municipality, in a municipal government. In our case, because we're sort of a more rural area and the whole population of Hampshire County is not even as big as some cities in Massachusetts, we're taking a more regional approach. And so essentially, Kristen and I working with Healthy Hampshire at the Collaborative for Educational Services, we're like here to staff the project, and we're here to work with all of the communities that are under the Mass in Motion grant to kind of apply these frameworks in their communities and to help with this community engagement, to help with the needs assessment and root cause analysis, to help communities really start to think about, you know, how do we dig a little bit deeper and identify some of those bigger picture changes, what we call policy systems and environmental changes that will really have a significant impact on health outcomes for residents of our community. So some of the things that have been talked about, like sidewalks or food retail opportunities or things like that, are like the types of things that, you know, we're really encouraged to work on with these Mass in Motion dollars. And in order to do that, you know, we really want to work on the municipal side, on the side of leaders and decision makers and people who can make these things happen, but also on the community side to identify, okay, what are the challenges? What are the solutions? We're not going to come in and say, you know, what this community needs. We really want to talk to the folks who are experiencing the challenges and have the solutions come from that space. So I would say more than anything, like, you know, it's sort of like, what is Mass in Motion? Like, Mass in Motion is sort of a funding program, and it's a framework that gets adopted by different communities to create a different approach to working on health issues in those communities.
I just want to acknowledge the question from Alexandra. So Mass in Motion does fund the communities that apply. So Healthy Hampshire as a community has a funding pool, and every community works together to see how they're going to allocate it or spend it on projects and things like that. But part of what we, you know, Mass in Motion is also encouraging is finding out really what are the needs. So this is why this conversation is happening. Like, what are the root causes in Hampshire County that are leading to people, you know, not having access to healthy eating options or not having access to active living? There should be like physical activity. So yes, it does fund projects, and Kaylin and Kristen can definitely go more into details on how that looks in Hampshire County, but and throughout the state, it looks a little bit differently depending on the community and their needs.
Yeah, and I would reframe it a little bit, because I think, you know, one of the things that Mass in Motion really emphasizes is the Department of Public Health doesn't want us using this money to like run programs, right? Like, they don't want us, you know, Healthy Hampshire to like start a farmer's market and staff the farmer's market and like use the Mass in Motion dollars for that. They really want us to use it to kind of like pay for the systems and infrastructure and staff time and things like that, you know, community engagement, the things that would lead to that type of an outcome, but to have somebody else kind of taking on that outcome, and particularly the town, like to whatever degree we can get municipalities to really be the drivers on these projects is huge, because you know, policy, changing municipal policy or even state level policy is a really long-term, sustainable, effective way to make these changes, and large-scale way to make these changes. So, you know, when we talk about Mass in Motion funding projects, like, I would say what's more typical, because we're not actually talking about a ton of funding. You know, we're not getting like hundreds and hundreds of thousands of dollars a year here. So, you know, what's more typical, I would say, is that we use the dollars that we get from Mass in Motion to have community conversations, identify like what some of those priorities are that the community or the population we're working with wants to work on. And then we can certainly help identify other sources of funding if they're needed to achieve those goals. But I wouldn't say like the Mass in Motion dollars themselves are typically going to be like funding projects or programs. I don't know. Am I answering questions? Yeah. Yeah, go ahead, George.
What I'm gathering is that it's as much about the modus operandi as it is about the result. In fact, it's the result of the modus operandi isn't the actual result. It's organizing the people who will then create the result.
Yeah. Yeah.
Very,
yeah. Yeah. Very well said. Yeah.
Yes.
I find you know, the goals of the organization are something my entire life I've been passionate about. But I'm at a loss as to how to, like, in my town, Northampton, which is a very fortunate and gifted town, but my Department of Health is oblivious. It really is oblivious, or maybe it's just political and it can't address the real issues. You know, my local hospital, I was in the ICU for 9 days, you know, and I couldn't eat the food. It literally is poison. And so, you know, I can't turn to these people. I don't, you know, the only thing I can see is trying to turn to the populace and educating enough people to act on their own. My town is educated, but its education has made them very ignorant. So I'm passionate about this. I'm still at a loss as what avenues to take, but I really like this organization, and I'd like to stay in, because I'm a part of it. You know, the Grow Food Northampton PAC, I'm a part of that as a low-income, you know, person. So I'm very, you know, I'm like, just keep in touch, but I'm still not quite sure as to how I could fit in, but I like what you're doing.
Yeah, absolutely. Well, and I think being on the FAC and being part of the Food Policy Council is a great way to plug in. It's one of the awesome ways to plug in. And Kristen will talk a little bit at the end about some of the other ways to kind of plug in. But yeah, great questions. And, you know, I know you're in our network, and now I know, I recognize your name, which I think you typically go by Shaker. Is that right? Yeah. Okay. So yeah, so we'll definitely, you know, you'll be kept in the loop for sure. And we'll be able to continue having these conversations and coming back to you and including you in these conversations, which is great. Ezekiel, I saw you raise your hand.
Yeah, tell me if this is off topic too much, but I was curious how you're thinking about engaging differently now that you're working with 18 communities instead of 4 communities, just because that's such a massive shift. I'm curious about, and I think much of the people here today are from the 4 communities that you have been funding previously. So I was curious how you're thinking about engaging those additional 14 communities.
Yeah, great question. So Kristen and I have been working out our approach here because yes, it definitely is a huge shift. And, you know, we've already acknowledged to ourselves and to many other people that, you know, we probably will not be working really actively in every community every year that we have this grant, right? So we're going to have to kind of keep our ears to the ground and do engagement as best we can and sort of figure out what are the issues coming up that like feel really ripe for us to work on and for us to support. But in terms of these initial stages, what we've been doing is reaching out specifically to municipalities that have significant what's called environmental justice population. So basically meaning a significant portion of the community is low income and or people of color and or somebody help me out here. Sharon.
English isolation.
English isolation. So, and or yeah, has limited English proficiency. And so so those communities in Hampshire County are Ware, Amherst, I think East Hampton and Northampton. And so we're sort of starting in those communities and saying, okay, how can we do some targeted engagement here? And at the same time, you know, we have been, somebody brought up the Food Policy Council, and we've been organizing that Food Policy Council and getting it off the ground for the past year or so. And there's really a structure in the Food Policy Council through which we can kind of support people to do self-governed work, I would say. And so we definitely are encouraging people to like get involved in the Food Policy Council and like plug into the work that way. But also, you know, say you, Ezekiel, you know, said, okay, there are, you know, I know this group of people in Belchertown who really want to work on, making it so that we can have roosters in our backyard. I'm just pulling up an example, right? So we could, work with you and basically say, okay, well, here's an approach to kind of organizing and having those conversations. And let's start by just like having the conversations and getting in together regularly and really trying to like look at this specific issue. And so I think our approach is going to be a little bit more driven by kind of where we see needs coming up, trying to stay in touch with people on the ground, and then trying to kind of organize around those specific needs that we see coming up. Whereas in the past, we, would sort of meet with every single community every year and try to figure out, what can we do in this community this year. So it'll be a little bit more regional and needs-based, I would say. Is there anything left to the presentation?
No, I think we
Just
actually
questions.
Somebody wanted to speak. Sorry.
No, it was me. Go ahead.
Oh, no, I believe part of it was actually to pass it off to you for next steps. And we just want to say thank you again for your time and energy and input. Again, this is very introductory, initial, first off, hello. And also this is what Mass in Motion is about. We do know that systems were created that are complex, and like we're trying to approach it in a way that is also realistic and amazing and really bringing all our strengths together. So I'm really grateful that this is a start for Healthy Hampshire and for you all to start the conversation and see where you fit in. And you might not know after this, and that's okay. There's more conversations and more time for that. And we're here as your technical assistance providers to really be another listening ear, really brainstorm and really support you all from what you all see in your communities, what you find out what the community needs, and then how to approach it. So thank you, Caitlin and Kristen, for really asking us to be in this space, and we're here to listen in and sort of support that in. I'm not sure if anybody else from our team, our team and the TA team wants to share something, and then we'll sort of pass it on to you, Caitlin, for the next steps.
Well, we definitely appreciate all of you coming from HRAA and MAPC to talk about this, and Matt from MAHB. We have a lot of awesome support here in the room tonight. So this is a really good display of some of the resources and expertise that are available to Healthy Hampshire and to the communities that are a part of Healthy Hampshire as part of the Mass in Motion program. So one next step that I will put in the chat is we do have a little evaluation of this session and how it helped or didn't help your understanding of Mass in Motion, and a little bit in there about next steps. So I'll put a link to that in the chat, and then Kristen, I'll pass it to you for the other next steps.
Thanks. Yeah. So yeah, we just thought about what are some things after this session that you might be wanting to do to kind of take next steps if this is all sounding exciting to you. So there's a few things that we thought of. If the idea of doing a needs assessment or a root cause analysis in your community, in a group that you work with, at an organization that you work with, we can help you do that. And I know, Tamar, your question really made me think like you're not alone. We're here to help you with this work. That's really what our job is, and the funding that we get is to support communities to do this, to figure out how do we bring a group of people together and how do we have these conversations and engage people around developing solutions to the issues that they face in their lives. So if you're interested in, doing the tree exercise or the fishbone exercise or some other version of that, if you know that a group that you're working with or your town is already doing some similar types of work, trying to understand what the needs are in your community, definitely reach out to us. You can just email Caitlin or me, maybe Caitlin, you can put our emails in the chat just so people have them. And, we'll just set up a meeting and find a time to talk and see what you're thinking about and, kind of work together to develop something that will work for whatever the group is that you're excited about working with. The other thing is, I'm just looking at my notes here. Yeah, I think that's especially true for folks that are new Mass in Motion communities. I appreciated that question too, Ezekiel, about how are we going to engage 18 communities, right? So we're definitely interested in those communities that Caitlin mentioned that have big environmental justice populations or some populations, but also new communities that this work is just brand new for you and you really, want to start working with these tools and talking about social determinants of health. And we'd be really excited to come and meet with a group and do some of this work together. So we are planning a couple of sessions in the next couple of months in Amherst, in Northampton, in the Hill Towns, and in the Quabog area. So we're doing some towns and then some kind of regions because of our sort of small rural characteristics of some of our communities. So definitely keep an eye out. We'll be emailing, like we did for this event, to let you know what's unfolding. We're still working on developing those ideas. If you're in one of those areas and you would like to have a input into how that comes together, again, just let us know. We'd love to talk and think together. And then, the last thing is, if you're like, oh, but I just want to get going on some stuff, or I want to do some stuff. We have the Hampshire County Food Policy Council is up and running. We've got over 50 people now engaged in, I think, 14 or 15 different circles or committees working on all kinds of different stuff, from mobile markets, community gardens, storytelling, policy advocacy. There's really a lot of different ways that you can, depending on your interests, you'll find a place, I think, to plug in. And if you don't, you can always start a new circle, which is the cool thing about the structure that we're using. People can come together to work on any issue that they want. All you kind of need to have is a group of people that want to work together, and we'll support you to start meeting and start working together. So we've got the website in the chat. We have a calendar on the website with all of the meetings that are kind of scheduled out for the Food Policy Council. The meetings are open to anyone, so you can always just come to a meeting if you want to, hear what's going on there. Our meeting notes are also available through our website. If you're not able to access them, there will be a link that you can request access. So if you want to read about what's going on in any of the circles, you can do that. And then the other thing is, on our website, under the Get Involved tab, there is an interest form. If you want to say kind of like, I want to get involved, I'm not sure how or where or what to do, but I want to get involved, you can fill out that form and it'll come to Caitlin and I, and we'll reach back out to you and help you figure out, how to get plugged in the place that feels right for you. So I think that's all I have. It's been really nice to see everyone here today and to know that you're all also representing so many other people, and the folks that you work with that couldn't be here. So I'm really excited to be kicking off our Mass in Motion decade together. It's the beginning of hopefully a really great long partnership for us.
Yes, thank you. And I'll just close it off. If y'all want to do a final stretch before you head out to have probably delicious dinner, share the recipe. or go about your night. We're really grateful for your time and energy again. And I really look forward to learning more and seeing you all do the amazing things that you do in your community. So I think it's a good time to let folks go. I'm not sure the TA providers and Caitlin and Kristen, you want to stay maybe for a little bit to debrief, like 5 minutes tops. You can, but thank you all. Have a great night. See you around.
Thanks, everyone.
Feel free to stop the recording too if you like, Kristen.
Yeah.